Hello everyone, my name is Emily, physician assistant and yoga instructor. I made a group of videos here for us to go deeper into the anatomy for a yogi of these most common yoga positions that we're in frequently. Today I'm going to be discussing Warrior 1. For this position, the target areas include the abs, the internal and external obliques, the front deep abs, the rectus abdominis, the erector spinae. Okay, let's go ahead and get into Warrior 1 so we can activate these muscles. You're also activating this quad on the right, vastus medialis, vastus lateralis, bicep femoris, gastronemius, soleus, and tibialis anterior on the front of both shins here. Again, in these warrior poses and mountain pose, you want to be sure that you're squeezing your quads up onto the femur bones, which are the long bones of your legs. All right, hips are forward for this. Important point, I like to point out to students in my class, if you're having an issue with form, go ahead and bend that back left leg as much as you need. Put the hips forward where they need to be pointing. So for Warrior 1, hips are pointing forward, not to the side like Warrior 2. And then once you have that correct alignment, you can go ahead and play around with extending that back leg out again, remembering to squeeze that quad off of the kneecap, okay? All right. For patients with knee issues, you want to make sure that they avoid entirely tracking over that front foot there. You want to make sure that they have at least a 90-degree bend in this front angle, in this front knee here, possibly more. All right. Again, we're going to avoid excessive lordosis of the lumbar spine by curling that tailbone under with that bent leg technique for form modification and correction. For this pose, the back foot is at a 45-degree angle. Okay? Overall, very safe pose, very functional pose, can be adjusted any amount based on the patient's limb length and flexibility to give them the safest possible pose with the maximum benefit. I hope you enjoyed this little medical spin on the most common poses in yoga. Again, my name is Emily, physician assistant and yoga instructor. Thank you so much for watching. We'll see you on the next one. Hello, welcome. Namaste. My name is Emily. I'm a physician assistant who specializes in neurosurgery, and I'm also a yoga instructor. So this gives me a unique insight on some of the most common yoga poses. I created a series of videos for instructors and students alike to help advance their practice and help with cueing techniques for students in their class. So for today, we're going to be just doing the arms of eagle, all right? Now this pose, some of the target areas, this is an isometric stretching pose for the most part, and a twisting pose, and actually a reverse back opener as well for that upper thoracic spine. So for this pose, patients who have had shoulder injuries, such as impingement syndrome, rotator cuff tear, frozen shoulder, which is also called adhesive capsulitis, anything that would limit their range of motion in their shoulders, particularly in the forward plane, the frontal plane, and the lateral plane, is going to limit their mobility on this exercise significantly. All right, so you want to give them a little bit of flexibility and time to get into this posture. So cueing the posture is very simple. Always, you're going to start on the right side with the right arm going over the left. So bringing it up, bringing that elbow in here, in between the crook of the left elbow, and if they can, wrapping their hands together like so. Now, I like to cue in class a small arch of the upper back to help open and elongate, because like I mentioned before, this is in fact a small back opener for the upper thoracic spine. As you can see, even if I were in the standing expression, I'm opening that upper thoracic spine, expanding that really difficult part of the back to open up. Taking a few deep breaths here. So, for this pose, you're targeting a deep stretch in actually the lats, the posterior deltoid, the entire shoulder girdle, which includes 4 muscles: sits, supraspinatus, infraspinatus, teres minor and major, and subscapularis. Very important to stretch these muscles as they are the scaffolding that holds your scapula where it needs to be. You're also stretching your rhomboids and the trapezius muscles. You can actually even see mine. These are common with spasms. So these patients are going to need to take a little bit slower to get into the stretch and quite likely won't be able to wrap their arms all the way around. So give them a little time and flexibility to do what feels right for their body, offering them some correct modifications and a little medical insight. Thanks for watching. We'll see you on the next video.